When it comes to improving your hip flexion to squat deep like this, I often showcase a posterior hip stretch like this, where we sit back slightly into hip flexion and then we shove the hip out to the side, anterior tilt the pelvis, and rotate toward that stretching side to get a full stretch on these posterior lateral hip tissues like the glute max, glute med, glute min. Now oftentimes people get into this and they just feel a pinch in the front of the hip due to the starting position of the pelvis. So try this drill before stretching your glutes and you shouldn't get that pinch anymore. So we're going to set up with the stretching side leg on top of a bench. Now we're going to use hip flexion here to help drag the pelvis posterior so we improve that opposite direction of what we would need for pure hip flexion, which would be an anterior tilt. Now, if we're chronically stuck in an anterior tilt and we have difficulty going the opposite direction, then it's going to be tough for us to actually move the femur relative to the pelvis to squat deep. We're going to hit that roadblock early. So from this position, I'm going to set up with the back knee under the hip. I'm going to tuck the pelvis under, and then I'm going to move into this deep lunge position. Now, because the pelvis is tucked under, I should be able to access more range of motion here without so much of a pinch in the front of the hip. Now, I'm going to hold this bottom position, and I'm going to contract my foot into the bench, 5 to 10 seconds, and then relax. Actively try to pull my knee upwards as I sink a little bit lower. Now it's important here that we're not deviating out to the side into external rotation or rotating into more internal rotation. We're just keeping the knee in line with the hip, pure hip flexion and posterior tilt. So we'll do that again. Push, 2, 3, 4, 5, and then pull the opposite direction, as if we're trying to crush something between our thigh and our shoulder. So perform about 3 cycles of that, seeing if you can go a little bit lower. I'll retest that quadruped glute stretch on that same side, and now see if you can access more hip flexion and more of a stretch in that glute, because now the pelvis has a bit more variability to move into the opposing direction, which would now be an anterior tilt.